Place the person on their back on a firm surface, such as the floor. Open the airway by tilting the person's head back slightly and lift the chin to open the airway, then look and remove anything that might be blocking the airway. Place the heel of one hand in the center of the chest on the breastbone. Place your other hand on top of the first one and interlock fingers. Apply strong pressure to the chest by pushing down at least 2 inches deep. Now do it 30 times quick and forceful. On my count, ready, start. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, again. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 30. Now do rescue breaths, starting by pinching the person's nose to close it. Pull the chin down to open the mouth. Place your lips over the person's mouth, creating a seal. Gently blow into their mouth until you see their chest rise, then stop and allow the chest to fall. Do the rescue breaths twice. If the person does not start breathing, continue the cycle of 30 chest compressions and to rescue breaths.